It isn't that as a weightlifter, you shouldn't want to be pain-free. Who actually seeks to be in pain all the time? My main focus was to be pain-free. I could achieve that a lot of ways. My goal as a weightlifter and as an athlete was to be able to train in a way that was productive and to compete in a way that was meaningful.
That's Dr. Neville Chu. He's a weightlifting coach and doctor of physical therapy with a unique approach to rehab. And in this episode, we dive deep on why there's less of a difference between rehab and training than you think.
I used to do this a lot, and I would say, like, well, the data says, the research, and no one cares. They're not asking for a research paper. They're asking for a solution.
Why weightlifters need to redefine pain and injury.
Pain is defined by what you feel, but an injury is a little bit more comprehensive in that it really takes into account your ability to perform at the intended level.
And bust some of the most common weightlifting rehab myths.
Every lifter's got those days where your snatches just feel so smooth. You feel like you could snatch a 10 kilo PR easily because it's just moving that well. And that has nothing to do with your injury, that's your confidence. Coaches play a huge role in this portion of an athlete's comeback. They are probably the person that the athlete listens to the most when it comes to technique. Technique to me does not prevent injury. What it really does is...
Welcome back to the Last Set Best Set podcast. I'm Coach Brian. I'm the owner of Big Ben Strength, and I've been teaching Olympic lifting for 11 years now.
I'm Coach Calvin, current captain of Lindenwood University's Olympic weightlifting program, as well as a coach through Big Ben Strength.
And today, guys, we have a special guest for you, Dr. Neville Chu. He's a doctor of physical therapy and a weightlifting coach, and he does a lot of work in bridging the gap between rehab and training for weightlifters. Dr. Chu, thank you for joining us.
Hey, guys. Thanks for having me on.
We wanted to kind of get into this pretty quickly here, but first, can you tell us about your background and how you got into the sport of weightlifting? Because you've actually been in it for quite a long time.
Yeah, I actually got into weightlifting around 2008. I was introduced to CrossFit through some colleagues. I was a personal trainer at the time, and I fell into CrossFit just kind of randomly and fell in love with it. I love the intensity of it, and then from there, I was introduced to weightlifting, and I fell more in love with that. So 2009 is also when I started PT school, and it's really hard in PT school to train multiple things at once. So I really just stuck with weightlifting because I enjoyed it a lot more, and so ever since 2009, I've just been focused solely on that.
And that's probably a journey that a lot of people have experienced, and is getting started with CrossFit, learning the Olympic lifts through that, and just being like, yeah, I think I kind of like this a little bit more than I like the heavy breathing and the running and doing all the gymnastic stuff. I mean, that was how I got into it as well. So that's pretty cool. And so from that, you went into physical therapy school. You said that you were kind of the black sheep of the group in school, because everybody was telling you that like weightlifting is just bad for you. It's going to be awful for your body. What was that experience like?
It's kind of interesting. In PT school back then, PT schools in that time didn't have a very strong education in exercise selection, exercise programming, exercise physiology, from a strength and conditioning standpoint. And a lot of them still don't, from my understanding. I've been removed from PT schools for 14 years now. So I can't say with 100% certainty, but back then we learned very little, especially at my school. I went to Boston University, and we were a very heavily manual therapy focused school. So we learned all the, hands-on tips and tricks, like how to crack this, how to manipulate that, or mobilize this joint, and all these kinds of things. We were really good with our, excuse me, we were really good with our hands. Um, but as far as when it came to how to use exercise to improve someone's injury status, we didn't receive a great education on that. And so, the thought from that kind of came down from the top was that, heavy intensive exercise or especially heavy intensive um, weightlifting or lifting of weights, because they didn't even think about snatch and clean and jerk, was that it was kind of reckless, dangerous, maybe unnecessary. Why lift so heavy if you don't have to? Why try to squat 315 if you're never going to do that in real life? And so, but with my weightlifting background, by the time that I started school, I kind of viewed everything that I was learning through the lens of an athlete as opposed to the lens of a patient, right? And the lens of a patient, how they were teaching us was, what hurts and how do I make it stop hurting? But the lens of an athlete is, okay, this hurts, but how do I continue to perform? How do I continue to play rugby, soccer, basketball, football, weightlifting, and stuff like that? And so, um, my whole philosophy in school, and that I would always counter people with, was, what is the harm in making something stronger? And they could never really answer that, and that kind of frustrated people. And I didn't, I wasn't the favorite amongst some of my professors, but like, what is the harm of making a joint stronger than it needs to ever be in quote unquote real life? Wouldn't that just naturally make life a little bit easier?
Yeah, and it seems like there's kind of been these pendulum swings within the industry, and I'm not a physical therapist, but I pay attention to it a lot, especially on the social media side of things. So who knows whether that's being misconstrued or portrayed incorrectly, or done differently. But when I first got into weightlifting, PT was essentially boiled down to manual body work, right? Like foam rolling, scraping was a big thing, and that kind of thing. And then it slowly kind of started to turn into accessory exercises was a big part of that, and that started to become a little bit more of a trend. And now it seems like the topic is really about load management and exercise selection and adjusting your training on the day based on that. Is that something that you would agree? Has there been this kind of shifts in the narrative over time in physical therapy? And what do you think about like where we're at now?
Yeah, and we have tons of shifts, because everybody kind of wants to, the thing with all of the shifts that we've had, and I think the one that it needs to also get mentioned is, and this is, I've been a part of all of the shifts. I was like, I'm going to be a huge proponent of this, and this is where I'm going to like narrow my focus, and I'm going to do this, and I'm going to do that. And as I've evolved in my practice, I've realized that every focus or every shift that we've had professionally, we're just focusing on a tool as opposed to the entire toolbox, right? Um, we've even had big shifts, and I was a big part of this one, is the pain science or the biopsychosocial approach to pain management, right? And so I was really big into telling people like, hey, and I wouldn't say this in these words, but just to kind of just, you know, be brief about it, I would be like, this and this is going on in your body, but your pain is being processed in the brain. And then it was, the messaging that I was giving was really like, it's all kind of, the messaging that they were hearing from me, I should say, was that this is in their head. And that's an ineffective way to approach a patient who is like, my knee hurts like a 10 out of 10, and you're telling me it's in my head, but it's in my knee, right? And you realize after you kind of like mature some more is that the all of these things, they're part of, they're tools, right? You have to have an understanding of all of these concepts and what these concepts are trying to communicate to a patient, and then you put them together of what is most beneficial for this particular person. And so sometimes I can have a very like cerebral psychological conversation about pain and pain processing and pain symptom amplification in their head, and or like how significant is their pain truly in their body, and how is it being processed in their mind, of like how is it truly limiting them. I can have those with some people more effectively than I can have with others. It really is context specific. I even did like after PT school, I did a year of residency in manual therapy, which I don't use any. I used it a ton, and I don't use any of it anymore. Um, and not because I don't think it can be, not because I don't think it can help people feel better, but because again, it's just a tool, and the narrative of that tool I didn't like anymore. The narrative of the tool back then, as I learned it, was if I do this and this with my hands to your body, you will feel better and you will be fixed. I am actually making a change in your body with my hands. And as you kind of like really dive deep into that narrative, it's just not true. You know, does it make somebody feel better? Absolutely. Do I know why? I can't fully say why, but I'm not gonna, again, another tool that I can use with some people, but it's not the whole toolbox. And so, yeah, we've definitely had some huge shifts. And now we have, then we've shifted recently to like, it's load management, it's exercise selection, it's really just like You can train through anything, which is kind of a dangerous narrative as well, right? If you have an athlete who has like a stress fracture in their tibia, and you're like, you could train through anything, and then that stress fracture turns into a full blown, like, you just caused that person harm. So, um, yeah, we continue to shift, and I think it's because we're realizing that as a profession we just don't have all the answers, and we're just constantly looking to find more answers to help people.
Absolutely.
But before we get into that, we have this week's Onyx Lift of the Week, who wins a free pair of straps just for tagging us in their lifts. This is Wesley_lifting with a 225 snatch PR. And me and Brian were thinking about this lift, and he actually remembers when Wesley tagged us in a 145 snatch. So let's take a look at the difference between those two, because he has just made so much progress over the last year or two.
It's been kind of crazy to think that we've been doing the podcast long enough that people have been tagging us in their list for this long. But this is pretty insane. Like this 145 snatch, this looks like high school weightlifting, right? This looks like Florida high school weightlifting a little bit. But then we come and see, a few years later, this 225 snatch is insane. Like this looks so cool. I mean, this looks great. And to see the progress just over the last few years is pretty impressive. And I know he's a junior in high school. I know he's trying to gun for some potential state records. I know we were talking about that a little bit earlier today. And so I think he's got that, and he's got a whole nother year ahead of him too. I'm impressed. I'm impressed, but I'm also curious to see how much better he's going to continue to get with a whole nother year of high school underneath his belt too.
Yeah, absolutely. And if you want to be the winner of the next pair of free straps, be sure to tag at LastSetPod, at CalvinLike81kg, at Big Ben Strength, or at Onyx Straps. And we'll get back into the episode now.
So I saw you post something recently, and I wanted to ask you about this. You said being pain-free as a primary goal is probably a bad primary goal for weightlifters. Can you explain this a little bit?
It isn't that as a weightlifter you shouldn't want to be pain free, right? Who actually seeks to be in pain all of the time? It's more so our expectation. So if your primary goal in as a weightlifter is let's take for example, I've got a shoulder injury, right? I actually had this last year as I was prepping for Masters Nationals. I don't know what it was that I did, but I could not lift my right arm over like my ear. I couldn't even get it over my head. And so imagine trying to do snatches, like nothing was happening. And it hurt. It was like a 9 out of 10 every time I touched the bar, picked it up over a certain height. But if my main focus was to be pain free, I could achieve that a lot of ways. One, I could just do no snatches and no cleans and no jerks, and therefore I wouldn't be a weightlifter. But I would achieve the goal of being pain free, right? I could I could wait until my shoulder was completely pain free to start training again. But by the time realistically that happened, my Masters Nationals would have passed. And so I did things that I needed to do that, I did my own rehab program. I even got a cortisone injection, which is, some people are like, "Ooh, you're a PT and you went to get cortisone injection." I don't have an issue with that in certain contexts. I got a cortisone injection. It really put me over the hump, and I was not pain-free at all. I was still in some discomfort all the way up until nationals, but I was able to train for it and I was able to compete in it. And so my goal as a weightlifter and as an athlete was to be able to train in a way that was productive and to compete in a way that was meaningful. And I feel like if you ask any weightlifter, like, yeah, you want to train in a way that's productive and they want to compete in a way that's meaningful, right? Um, and so I did that, and I didn't finish nationals pain free, but that wasn't my primary goal. Had I waited for pain free to be the goal that I achieved to be able to do what I wanted to, who knows how long it would have taken. And by that time, like, I would have lost a lot of potential progress in the sport.
Dude, absolutely. I mean, that makes a ton of sense. I think pretty much anybody who's ever competed in something can maybe agree with this and say, like, is weightlifting bad for you? No, weightlifting's great for you. But anything is great for you usually up until you start competing in it, and then we have a shift in priorities, right? When I start competing in weightlifting, I'm not saying that I want to be the healthiest possible person. I'm saying that this is a hobby that I pursue and it's meaningful to me, and this is just something that I enjoy doing. And so I'm willing to say that on the other side of that, there might be risks that are associated with it. Absolutely. I mean, the risk may not even be injury. The risk may just be that I snatch a bar and I drop the bar on my head because I didn't catch it right. Right? It's not the shoulder that's the problem there, but that's a very real reality that can absolutely happen. And I think sometimes what you're saying there, right, is about managing the expectations. Is you are competing in a sport now. You're willingly saying that your priority is lifting as much weight as you possibly can, and then everybody will have different constraints that they'll place on that. I'm lifting as much as I possibly can while only training an hour and a half, 4 times a week. And then other people are saying, I'm lifting as much weight as I possibly can, and I'm going to train an hour and a half, 4 times a week, but I'm also going to be really locked in with my diet, and I'm going to be really locked in with my recovery. And then other people are going to have a different constraint. They're going to say, I'm going to try and lift as much weight as I possibly can, and I'm going to train 6 times a week because that's what I have the capacity to do. And each person is accepting a slightly different amount of risk that comes with that. Sometimes that risk is injury, but other times that risk is a negative impact on your social life, right? And I think that people are much more willing to talk about that risk to other things like your social life because it makes them seem more hardcore. But an absolute common part of this is just like accepting that there are things that are going to hurt when you train hard. And that's okay. That's not a bad thing. It's just making sure that when you expect that, you know what to do next. So let's say like when somebody does accept the reality that there is pain and then pain sets in from training, what's the next step? How should an athlete think about pain the first time that they start experiencing it? What's the next step to ask?
I think the first step, and this has been said by many people from in my position, is one, don't freak out. Um, you know, in our sport, we're lucky enough that um, those super traumatic injuries where, you've got like a significant fracture that you can clearly tell, like we don't have those as often as like, oh, my knee starting to bug me, or like my back just kind of like tweaked or whatever. Like we have more of those, right? It's not like we're on an NFL field and all of a sudden like the ACL twist and the leg is like this way and all this kind of stuff. We don't have that as often. And so when an athlete comes across pain, my first instruction to them, or my first bit of advice, is like, okay, let's try to take a breath and we reassess, right? I always ask them like I ask everybody who's asking about pain this, is start taking notes of patterns, right? So how does your pain behave during a set? How does your pain behave after a set? How does your pain behave when you transition from one exercise to the next in the course of your workout after the first 20 minutes, 40 minutes, right? Because most training sessions are like what, hour and a half to 2 hours, some even longer depending on your level, right? How is it behaving between all of those things? And then how is it behaving between sessions, right? And so you'll notice that I don't tell people just to stop lifting unless like they're in a position where like you've had people who they'll do a pull and then their back kind of tweaks and like they literally can't even like stand up or breathe, and then yeah, you're not going to lift anymore because like what are you actually going to be able to accomplish? But if you're kind of like noticing something, I don't tell people to stop. I tell people to take notes, right? And then the other thing that they need to do is go back into the notes, and this is why every athlete needs to keep a log and not just have your coach do the log for you, right? Is what cycle are you in? How far into the cycle are you? Have you just come off a deload, or are you about to go into a deload? Um, what cycle did you just come off of? Did you just have competitions? Like, what's the pattern of your training history dating back? And I give them like a general like 3 to 6 months, because that's going to give me a lot of information of like what's your body ready for, is really what I'm trying to get at. What is your body prepared for, and what are you asking of it? And do those two things match, right? And then the other thing is like, how long is it taking for things to calm down? Like I said, between sessions, is your discomfort, is your pain? I don't even use the word pain much anymore. I just use discomfort because I feel like it's just naturally is a more calming word to people that I work with. Um, is your discomfort coming down to like a baseline level within 24, 36 hours, right? If you're a 6 day a week athlete, which I don't know that many people who are 6 days a week anymore. But if you're a 6 day a week or 9 session a week athlete, yeah, we're gonna have a different conversation. But if you're kind of like the most of the people that I work with who are, you know, recreational lifters who are gearing up for local meets or maybe even national meets, you're probably 4 or 5 times a week, right? So do you have the are you coming down to a close to a baseline where you can continue to train for the next session? And then the other question that I ask is kind of like what everybody would ask in a medical office is what are your aggravating and alleviating factors? And the reason why I ask all of these questions or have people take all of these notes, not just so that the athlete themselves can start to take ownership of the process, because I think that's a huge part of the recovery process, right? Is a lot of people go into a therapy relationship with this idea of like, whatever you do is going to fix me. And my whole philosophy is no, I'm going to help you fix yourself, right? I'm going to give you the tools that you need to fix yourself. Because at the end of the day, I'm not snatching for you. You probably don't want that. I'm not going to do clean and jerks for you because you're probably better than me, right? What I'm going to help you do is get to a place where you're managing this yourself. So if you start to take this like audit on your own as an athlete from the start, you start to take ownership and you start to see patterns yourself and you start to have realizations and you start to take a much bigger portion of the collaborative process as opposed to like fix me, help me, tell me what to do, and I'm going to somehow magically get better because you have this like magical recipe, right? And then if you do end up having to go into another medical office, like let's say it's not getting better and you need to go see like a MD, like a orthopedist or something like that, um, they're going to ask these questions, or they should, you know, if they're going to give you the time to answer them. But if you have this information and you take it into a medical office and you just kind of like give them, these are all of the details, you're going to get much better care, or you're going to find out really quickly if you're going to get good care from that provider, right? As opposed to a lot of times we walk into these medical offices, especially with like the white coats, and you just sit there and they're like, what's wrong? And you just say, well, my back hurts. Well, when does it hurt? When I snatch? And they have no idea, like, what does that mean? You know, or why should they even care? They just want you to not be in pain and get out of their office, right? So if you have all of this information, you'll be not only a bigger part of the process, the healing process from the beginning, but you will be a better self advocate. You'll be a better advocate for yourself if we have to pivot to another sort of medical care.
I really like that framework that you kind of provided out. I think I'll summarize it real quick again because I took some notes here. So like step one, don't freak out. Like pain is like normal and part of the process, right? Step two, start taking notes and be detailed on, you know, when you're having this pain. Don't just like live in your head, you know, thinking about how this pain happens, but literally take notes and every aspect of how the pain is affecting your life and your training. Then look at your notes and kind of figure out, start to look at like, oh, when I go through my highest volume week, that's when I'm feeling it. Or, oh, it's the intensity that's bothering me. Kind of start to think about where these patterns are going. Then think about what makes it worse, what makes it better, those aggravating relieving factors. I think that's so cool. The mistake I see talking like with a lot of my teammates, people that have been lifting for 3 to 6 years, usually something in there, younger lifters, I feel like there's like maybe like a one step thing. Like it's like, oh, I hurt. What exercises do I do? That's where I see so many athletes get caught up. That's like the farthest they can go is like, oh, my back hurts. Well, I have to do reverse hypers. That's it. That's the solution. And I love the biopsychosocial model picture. I remember seeing that for the first time and just being like, whoa, like wait, like it's a little more complicated than this. And I think like what's your, obviously you gave this really good framework, but how do you communicate to an athlete? How do you teach them, hey, it's not just about doing this exercise. Like an exercise doesn't make you better. Where does that learning process start when you're working with patients or athletes?
That's a tough one. You know, and you're totally right. When it comes to an athlete that is hurt, they want to know what are the 3 to 5 things, and I get comments and DMs about this all the time. my shoulder hurts. What do I do? I mean, that's a very broad, um, and so they want to know 3 to 5 things that I can easily put into my program, and they won't say this part, but in a very, very convenient and time efficient way, that is low stress, that I can magically start snatching, clean, and jerking again, right?
And also, can you make the exercise something that I like doing, please?
Yeah, yeah, yeah. Can you make it easy enough for me to just kind of like do it in the gym where people will notice I'm doing something, and so I can kind of talk about my injury? Like we like to talk about our injuries, but then like, oh, my shoulder hurts, but I'm gonna, hit 85% today for whatever reason. It's just how it goes. But then when it comes to training, they're not gonna say, they don't really say like, I have my jerk. I let it go forward when I jerk. What are 3 exercises I should do right now to fix that, right? Like that's a very if you guys write, you coach, you write programs, you coach athletes, like that's a very broad, like the 3 exercises that work for you may not work for this person, right? And so the way that I get an athlete to kind of stop thinking about rehab, I guess you could say, in this like in this very like A plus B equals C type of thinking, is I ask for every time they ask me something, every question that they ask that is very much along those lines of like, what's the quick fix? I ask a question back, and I say, what are 3 exercises that I should do right now to make my knee feel better? Okay, well, when does it hurt? How do you how do you how does your brain process the pain as it's hurting? Are you the type to say, I'm going to train through anything, like it doesn't matter what it is, like I will push if you tell me to push? Are you the type to immediately back off? Like I've worked with all those people, right? Um, I had a client once who was a Green Beret, and he was like, "You tell me to like train with a bullet in my leg, I'm gonna train with a bullet in my leg because like that's how I am, right?" And so I'll ask a question back because that gives me more of an answer, and it makes them realize that there is no quick fix. And then they'll give me, then when it comes down to giving them what they're looking for, I'll give them, 2 exercises that I think this could help you, and this could help you because of these reasons of like this, what this exercise is done, or what this exercise is intended for. No guarantees that it will help you though. You can try these, and if they don't work, that's more information for us to continue this process. So really, it's kind of like I won't give them the answer that they're looking for, and just like have make it so that's like you can take this and take it or leave it. But it always leads back to more questions, either me asking them more questions or them having more questions to ask me, because then they start to realize that this is not something that is like quick fix. This is not something that is like, magic recipe. This is really a process type of a thing. And sometimes I'll even tell them like, just give it a week, it might go away.
That's it. I mean, you bring up a really great point there, right? It's you're asking questions back to the person, right? And it's kind of the same thing that coaches should be doing when they're talking to an athlete who's got some pain, right? The first thing that you do is get them to start asking questions, get them to start recognizing patterns. So you're essentially doing the same exact thing, but in a way where you kind of have to lead them through this the first time, right? And so many times people have like something pop up, and the first thing I say is like, "Is this the first time that this has happened?" And then that's like that'll give you so much info about what's going on. And then, is this something that is recurring? If that's the case, then that's going to give you a whole lot more information, right? If it's the first time, this may just be a fluke. We don't even need to think about it again, right? If it's a recurring issue, that maybe is a little bit more of a sign that we need to address this.
And one thing I've kind of stopped doing so much is, I used to do this a lot, and I would say like, well, the data says, the research, and no one cares. Like when they're hurting and they're like reaching out to you for help, they're not like they're not asking for a research paper. They're asking for a solution, right? Um, and so I've just kind of taken what I know from like what the data says and then form it into a question for them, like, and I'll just say like you said, is this the first time? Is this the second time? How often do you have this? Because that's part of what the data says, like of how, recurrence rates and um, how long symptoms may last for, how significantly you might feel them. stuff like that, depending on the body, depending on the injury. And I'll ask those questions just to kind of get those answers. Say, oh, from my experience, right? Because this isn't the first time you've had back pain. And I'll kind of frame it in a positive way. The good news is you kind of know how your body feels when you have back pain, and you know what's aggravating and what's alleviating. So let's explore those. You if this isn't the first time you've had back pain after a heavy squat cycle, like a high volume squat cycle, right? We kind of already have one answer there of what we can modify, where we're not going to lose gains, but we can just kind of tweak things to continue training in a productive way so that you can have a meaningful performance at the end of the cycle, right? And so I'll just kind of like instead of like being really, cerebral about it, I'll just kind of, again, it's just repackaging information that I have into a question for them to help them come towards an answer that is going to either turn on a light bulb in their head or give me something that's gonna or get me closer to an answer for them that they're gonna feel like, okay, this is at least moving the needle and this is what I want, right? They just really want, they're not always necessarily, it'd be nice for them to have their pain go away tomorrow with something that I said, right? Or something that I advise them to do. But what they're really asking for is just move the needle, help me move the needle a little bit to give me a glimmer of hope, and I can kind of continue on from there. Because we're weightlifters, right? If after a while, we should know that you're not going to get better, unless it's like you just started the sport. If you're like 8 years in, you're not going to get better tomorrow. You're going to get better after multiple tomorrows.
Tired of programming that doesn't work? Inconsistent technique, missing lifts, or going months without PRs is all signs that your program isn't working. If this is you, I'd like you to consider joining the OlyStrong team, my online weightlifting program available in 3, 4, and 5 days a week for weightlifters looking to dial in their technique, get strong, and most importantly, set PRs. Each week is structured to support the things all weightlifters need. Enough practice in the snatch and clean and jerk to dial in your technique, a consistent strength program to build big squats, pulls, and presses, and accessory work carefully chosen to build muscle that supports your Olympic lifts. The program uses logical progressions that focus on building momentum each week instead of just maxing out every week, or worse, only lifting light to work on your technique. If this sounds like something you need, then scan the QR code on the screen or click the link in the description below for a free week trial today. All right, back to the show.
Yeah, so why don't we transition a little bit? I think there's a lot of good takeaways there. This is probably a good section for somebody who's dealing with pain or injury to listen to maybe another time through even. But let's move on and talk about maybe just some more of the conceptual things surrounding pain and injury, and maybe even just start off by kind of defining those two things and what are the differences between I have a pain and I'm injured. How do you usually differentiate those?
That's kind of a tough one. But I would most simply say like pain is something that you feel, um, and injury is something that pain is defined by what you feel. No one can tell you if you're feeling back pain, knee pain, shoulder pain. No one can tell you if it's a lot of pain, a little pain, whatever pain, right? But an injury is a little bit more comprehensive in that it really takes into account your ability to perform at the intended level, right? Because not all injuries that limit your ability to perform are painful all the time, right? So let's say for example, um, I sprained my ankle, right? And it's swelled up like a balloon or whatever. That hurts. And initially it hurts. Obviously, it hurts and I can't perform. I have pain and an injury, right? But 3 weeks in, my pain is really manageable. Like it's not a big deal. But if you ask me to squat, if you ask me to do split jerks, right? I'm not going to be able to move in that. I'm not going to be able to move the way that I want to move. I'm not going to be able to train in a way that is intended for me to train, right? I'm probably going to be super modified. And so I would say then that I have an injury that I'm dealing with, but it's not painful, but I'm dealing with an injury because I can't split jerk. I can't squat to a certain depth. I can't, you know what I'm saying? And so I have to really modify all of my, as much as my training as I can to, and it's not the level of training that I'm able to produce at that point is probably not conducive to like, okay, we're 6 weeks out from a meet, let's sign up and let's do it, right? I'm probably going to have to push that off. And so I'll use benchmarks too, because if I'm saying like I'm injured, it, I have to have I have to have a goal in mind by a certain date to tell me if my performance is going to be meaningful or not.
Yeah, absolutely. So like maybe kind of like injuries are something that causes a modification or something like sort of like significantly deviating from normal training.
I think they can both create modifications, injuries definitely. Sometimes pain, I don't always modify training because of pain, right? Um, I'll give an example on that end. General knee pain with no like, we don't have any concerns of like an ACL or any like structural issues or any risks training, we'll put it that way, right? Oh, my knee kind of aches when I'm at 80% and above on this cycle. I had an athlete who recently had that actually, and he's peaking, and he was like, "Well, at 80% above, my knee kind of bugs me. Do I like not go above 80%?" And I told him, actually, what I do personally is I do really slow eccentrics at like 60, 65% for like a single, and then for whatever reason, that just makes my knee feel so much better when I'm hitting the heavier weights. And he tried it and was like, oh, I was able to do like 85, 90%. It wasn't completely pain free again, right? But again, he was able to train in a meaningful way. He was able to hit his numbers. He didn't have to modify his program. And then I asked him, take notes. Did your pain come back down to a basically negligible level within 24 hours? And it did. So we have no injury there. We just had pain that we had to modify some of the warm up, but we didn't really change the workout. We didn't have to, drop squats or drop volume or anything like that.
You posted recently something that I found pretty interesting, and this is something I agree with as well. You said that really there's no difference between rehab and training. It just we're starting at different points. Can you talk about that a little bit?
Yeah. So when it comes to the difference between rehab and training, isn't so much like the content of the work, like we kind of talked about earlier, like people think when they're injured, I have this bag of exercises that is like my rehab exercises. And then when I'm not injured, I have this pool of exercises that are like my training exercises. Um, Honestly, like you can use you can use the same exercises in both pools. It's just a different focus, right? So um, the difference between rehab and training to me is what are we working towards? Are we working towards getting back to a specific benchmark? One benchmark that I like to use for anybody who comes to me is like I can't snatch or clean and jerk without pain or significant pain is okay. Let's set a goal that you can train at. You can get up to 75% of your one rep max for a single for like for like three singles in a given session, and then by the next day you can do it again if you had to. That's a goal, right? And then rehab would say that if you can't do that, we're in a rehab stint and we're going to be working towards that. And if you're in a training stint, we're going to be pushing that, right? But we're using the same exercises, right? Let's say they can't do it because their back hurts. I'll use super slow snatch pulls, super slow snatch deadlifts, deficits, pauses, hangs, low hangs, whatever the person is able to tolerate that is going to drive some sort of meaningful stimulus to the body. Because if it's not driving any sort of like stimulus, it's not going to create a change, right? But if you're in rehab, we'll do it for, an example would be like higher volume, way longer tempos, and the goal would be to create a certain fatigue level that subsides within a certain time period. If you're in training, we're doing it at higher intensities. We're probably not doing as slow tempos. We're probably taking longer rest periods actually, and we're looking for systemic fatigue as opposed to localized fatigue. right? So the focus is different, the content is the same.
That's a really interesting point there that you said systemic fatigue versus like localized fatigue. I actually heard the same thing from my first weightlifting coach, Glenn Penlay, years ago, and um, he said general pain is a strength, specific soreness is a weakness. It's essentially the same idea, right? Is like if you're generally feeling a little beat up from training, that probably means that you're actually training pretty well, right? Like you're causing you're doing stuff that is causing enough of a stimulus that you're dipping a little bit so that when you adapt, you'll be a little bit higher, right? You have to create enough of a stimulus to cause an adaptation. And part of that stimulus is generally feeling a little bit worse after and then a little bit better a little bit later, right? But then if you're training and repeatedly you seem to always get beat up in one specific spot, right? Your lower back is a common one, or your shoulders are a common one, or your knee is a common one. That might be a sign that you have some specific weakness in an area. Is that kind of a fair assumption to say?
Yeah, you could say that. I mean, that's one way to look at it. I think if you're constantly feeling beat up in a particular body part, low back, knee, whatever, I would then look at kind of all the stuff we talked about before. Like, how are you, or what are the cycles that you're in? What are the training cycles that you came off of? And where are we identifying these, like, I don't want to call them red flags, but like, where are we identifying these like hot spots, right? If my knee is always bothering me, if my knee always acts up when I'm in a hypertrophy cycle, and it's because I'm giving eights on back squats, which is just, just cruelty, right? And that always bothers me. And the program is calls for like 4 sets of eights or 5 sets of eight at like a high intensity, right? Um, and that knee discomfort causes me to perform worse in the subsequent cycle. And maybe I don't need 4 sets of eight on the squat. Maybe I need 5 sixes, right? Because maybe for whatever reason, and it could even be mental, like I just hate eights and my body just like has a visceral reaction to them. But sixes, I'm totally fine with. I could push those all day, right? You can't really argue that, oh my, you have to do the eights though, because like this is going to give you the adaptation that you specifically need versus the sixes. I mean, we compete in snatch and clean and jerk. So at the end of the day, that's what really matters, right? So maybe we can modify a little bit of the cycle to reduce the hot spots to then continue to push forward. If that's what we're talking about, like a specific weakness that we have, right? Instead of like, well, you guys got to get better at eights. Like we don't necessarily, that may or may not have to be the case. We may be like beating our heads against the wall where we could pick low-hanging fruit by just a slight tweak in the programming.
Absolutely. So, can we go into a couple different examples of how you would approach some maybe some common issues that people have with their lifting? I've got a few different ones here that I think will probably most listeners can probably identify with here. So, first one. How would you approach working with an athlete who had a torn rotator cuff? They've gone through traditional PT and we'll say graduated, air quotes there, and is now kind of on this long road back to hitting personal best lifts, but their shoulder's still not feeling great, right? They're like, I did the PT. I did everything I was supposed to do. Why does my shoulder still hurt now that I'm kind of getting back into training a little bit? How do you approach something like that?
So that's a very specific example, and a challenging one. And I'm going to assume that if they are coming from, you said torn rotator cuff, so
Hmm.
I'm just going to assume that they had surgery,
Sure.
right? That's not always the case, not always necessary, but I'm just going to assume that they had surgery, went through traditional PT twice a week type of a thing through like a local clinic, and they graduated. My first question to them is going to be, what were the what was the criteria for your graduation? Because that is the expectation that they left PT with. Did it meet the expectation that they went into PT with? That mismatch tells me a ton about where we're currently at.
Let's say that let's say that this athlete they what their PT did was they got them back to being able to be pain free in like normal day to day life, but not training.
Hmm. Not training, right? So my first question then would be, or my next question then would be, how far removed are we from surgery? Like, how clear are we? Do we have do we have the necessary range of motion to be able to say, let's do some snatches or let's do some snatch related work, right? And then if they have the necessary range of motion, then I'm going to look at what are the things that are the hardest for you to do if we break the snatch down into components, right? Is it getting the bar? Is it the even like the having the your necessary grip width on the bar? Is that comfortable? Can you have a heavy load hanging from your shoulder in a snatch grip, right? Is that comfortable? Can you pull it and create acceleration off the hip and bring it close along the body? Is that comfortable? Can you turn the bar over or not? And I'm assuming they can't. That's, usually is one of the big limiting things. If that's the case, where is the turnover uncomfortable? And what's our cutoff? Like, you can muscle snatch the bar 30%, 40%, like that kind of stuff. And then do you have the ability to hold the weight overhead? So I'll basically just, if I'm screening this athlete, I will break down the bar into like 10, 12 components of the snatch. Then if you can turn the bar overhead, can we get behind the neck press? And then can we get into overhead squat? Do you have is it a starting position thing? Is it a transition thing? Is it a power development thing? Is it a load acceptance thing? Is it a support overhead type of a thing? Like,
Let's role play it a little bit. I've talked to enough people. I think we could do it. Okay, so I'm gonna go through. Here's kind of exactly what's going on. Um, Snatching generally feels good. Turnover is okay. I can sit in the bottom of the squat just fine, but coming out of the bottom of the overhead squat, I get an initial jolt. That's the main thing that I feel. I'm going to go ahead and say the other thing that I notice is that not so much in the snatch. It generally doesn't feel all that bad most of the time, except for that slight coming out of the bottom of the squat. But then in the clean, that's where I feel a lot of my issues. So I can get into setup position. I can be on the rack position, but when I have a clean and it slides down my shoulders just a little bit, if any amount of like a non-perfect position is happening on my front rack and the bottom of the squat, it immediately lights it up and feels awful. And then finally in the jerk, right? Rack position feels good. Overhead position feels good. But if I accidentally kind of press early with the arms and I don't get my leg drive fully involved, my shoulder hurts again. So that's kind of where we're at here. What's the next step that you're thinking through?
so I'll go back to the snatch one, since for the most part it seems okay except for that little bit. I use a lot of complexes in my rehab training or rehab coaching. So we would do, for this person, I would probably have a lot of like snatch push press into overhead squat, eccentrics, snatch progressing into like snatch balances, paused overhead squats, snatch with a hold at the bottom. Um, Power snatches, receiving at three different heights, that kind of stuff, that kind of a thing. So we're really just hammering home that ability to accept the load, hold the load overhead, and then all of your different, like, just kind of like hammering home the ability to do that, but also really focusing on strength, overhead strength in the snatch grip, right? I feel like, if they're coming from a traditional PT rehab step, there's probably a little bit more strength that they need to develop in that affected side.
So we're essentially looking at this like, how do we increase your capacity to handle stuff in as many different ways as possible with the snatch grip in the area that kind of generally hurts, so we can build up your ability to be in that without being in pain or without it being limiting, right? So you're looking at like snatch grip push presses, getting strong there, maybe tempo overhead squats or something along those lines, or snatch with a pause in the catch. Like that's the part that hurts the most. Let's pause there. Let's spend a little bit of extra time, maybe with lighter weights, and get it to the point where maybe with 50% it doesn't hurt, but then it starts to it at 70. Well, let's see if we can bump that minimum up a little bit higher so that it doesn't hurt with anything under 70%. And we just kind of work towards that. Is that kind of the approach that you're looking at there?
Basically, yeah. rehab and training to me have cycles. I mean, training, obviously, we know that they have cycles. That every cycle has a focus. Rehab is the same way, right? So, we would spend a lot of volume in these things that you just mentioned, and therefore I would take some of the volume away from some of the other stuff so that they would have the ability to recover as a whole. And then going on to the issue with the clean and the front rack, it's kind of the same concept. I would work on a lot of muscle clean, drop clean, tall clean, making sure that we're turning the bar over completely and we're not catching short. We're catching at the appropriate front rack position. Are we receiving the bar with like lazy shoulders? Are we, um, really advocating that scapular drive up to kind of support the bar off of the shoulder as opposed to just like resting and pulling us down. Again, we're going to do a lot of like bodybuilding type stuff to start the session or to finish the session, but we're going to do a lot of turnover technique work. We're going to do a lot of pause front squats, tempo front squats, so that you're really forced to have that scapular drive under or drive upward under fatigue, right? So that you're not only so that you're developing the resilience in the shoulder, but that you're getting confidence. You need exposure to get confidence, right? A lot of times, like a lot of people who have shoulder injuries will under pull and under turn and turn short and kind of catch like right in front of the collarbone because they're afraid of what that will do to their shoulder if they receive it in the proper position. Not because they can't, but because they're scared of, right? And so things that are going to develop not just the structural resilience, but the confidence.
That's an interesting one I noticed too. When people will have like shoulder issues and they're kind of coming back, they'll especially I've seen this in periods of time where we're starting to try and get back into peaking. We're handling generally normal training pretty well, but we'll hit a lift and it doesn't feel great. And then the next lift, you start to see them under pull, and then it starts to hurt worse. But you almost see that this is something I've noticed a lot with athletes is like in an effort to try and avoid pain, they almost tend to create more of it by changing their technique. Is that something that like do we kind of have to talk to athletes about that and say like, hey, this might actually be hurting more because you're under pulling and therefore leaving the bar out in front, and that extra little stress is feeling where instead we need to kind of pull confident, pull like it doesn't hurt, and you're going to catch, and it generally won't feel quite as bad. Is that something that, the coaches need to be thinking about?
Yeah, totally. I think, coaches play a huge role in this portion of an athlete's comeback, obviously, because, they are probably the person that the athlete listens to the most when it comes to technique, right? And I don't say this because I think, technique to me does not prevent injury. It doesn't reduce injury. What it really does is having efficient technique allows you to lift proficiently repeatedly, right? If my technique is effective for me, that means I can do it over and over and over again, um, comfortably. And I say comfortably because again, we talked about this sport is not comfortable, right? But I can repeat this movement in a way that works for me, right? And so sometimes like we have to definitely look at when you're in your example of, when you get to a certain percentage, you're under pulling, you're leaving out in front, and then you've got to correct back. You've created more need for horizontal movement, or you haven't really, like if it's the snatch, you haven't put the bar in a position where you can get into the bottom receiving position comfortably. That's a technical question. And it's not because, again, that technique creates or reduces injury. It's because it allows you to move in a way that works for you, that not only is effective for putting weight on the bar, but gives you confidence, right? Every lifter's got those days where you like your snatches just feel so smooth, like you feel like you could snatch like a 10 kilo PR easily because it's just moving that well. And that has nothing to do with your injury. That's your confidence. And that's what the technique is for, right? And sometimes after an injury like that is significant enough that requires surgery, like we have to maybe modify technique a little bit. We have to maybe find a new technique. Maybe your snatch grip your width is different now. Maybe your overhead positioning is different now. Maybe your clean and jerk technique is a little bit different now. Sometimes it's not even the shoulder. Maybe it's like your foot width in the catch that allows you more space for your trunk. which then allows you a better shelf in your front rack, which then allows you to come out of the hole more efficiently, which then saves you energy so that you can have a stronger leg drive into your jerk, which goes back to your original example of, if I push early with my arms and I don't finish my leg drive, my shoulder hurts and stuff like that. So maybe that's where we need to explore things. But that is a technical thing. And if the athlete and the coach have a really strong relationship, and that coach knows that athlete's technique very, very well, they can make those slight modifications that are going to have big impacts to, again, not only the athlete's ability to lift comfortably, but to lift confidently.
I love that. You know, something I've been finding more and more, I think maybe over the last 6 months, is just how much of coaching seems to be about making your athletes feel more confident. I don't know if either of you guys have noticed this with your guys' coaching, but I've kind of come to this conclusion a little bit more and more over time, is that I try and look at, like, how can I leave every session with an athlete where they are going to walk away feeling more confident about their own abilities. And that's not just like that's not me just hyping them up. Sometimes that's all it is, right? Sometimes it's just positive reinforcement, but other times it's exercise selection. It's giving them exercises that they were previously not confident in and they got better at, and now are way more confident in than they should be, or not that they should be, way more confident in something than they were previously. And a lot of that comes down to exercise, but that relates so closely to coming back from injury or from dealing with pain in your training. Is pain tends to make you less confident. Pain tends to tell you that you shouldn't be doing this, right? A lot of the time, that's the way that most people will interpret it. And so a lot of the coach's role, I think, should be in, how do we get people to feel more confident? And part of that is, how do we get them training slightly pain-free or less pain-free, or it's just making sure that when an athlete is experiencing pain, letting them know that it doesn't have to affect their confidence, and that sometimes it just needs an adjustment to the training plan. Now, I like this kind of role playing here with the rehab exercises and stuff like that. Can we talk about maybe another one that's a little bit more common for some people? Let's go into this one here. When I kind of start peaking my squat up, I'm on a strength cycle, I'm trying to peak, I want to hit a new 1 rep max back squat or a front squat at the end of this training cycle. But every time I do start to get back up into being able to handle 90% plus, my knee starts flaring up. I'll hit a squat session, I can hit the lift that I need to. It starts feeling worse as I get closer to that weight, but then particularly after, like that evening, my knee is just swollen and it feels awful. So what is the thing? This is the pattern that I've noticed, right? Last 2 squat peaks, it starts doing this exact same thing right around 90%. I've tried implementing more volume in my training in the prep leading up to this, so that I could maybe handle more training, and that didn't really seem to be all that effective. What's the next step? What's the next question to ask?
The next question I would say is, have you tried less volume? Because you said, I started hypothetically, added more volume before this so that I could handle more training. But maybe you don't need all that volume, and that volume is just creating this bucket of fatigue, this accumulation of fatigue that isn't being adequately shed by your body by the time it's time to start pushing 90%, right? And so I know my whole thing is like, we're just asking a lot of questions, right? But I would ask things like, is 90% necessary for you to improve snatch and clean and jerk? Like, how necessary? Like, let's say you squat 300 kilos, but you clean and jerk 120. Do you need to be pushing 90% of your squat to, maybe the issue there isn't so much about your strength, it's more so about your technique. And so we don't need to be squatting that often. So if it's an issue of, like, is it an issue of your programming your cycles? Like, what's your squat frequency? How many times a week are you squatting? And how much are you squatting in conjunction with other exercises, right? Other parts of your training? Like, how is it all being put together? Because it's all about the finished product, right? Not the individual ingredients, right? Um, and are there other lifts other than squats, other than traditional back squats, that we can push to still provide a carryover to your lifting, right? I think one thing with weightlifting that is that we underutilize a lot of the different squat variations that powerlifters use. I mean, you look at a powerlifting basket of squat exercises, and there's like a endless amount. You know, why can't we use that for weightlifters? Like safety squat bar, like different stance, like low bar, right? Can we do it? Can we use those types of squats? Because if the goal is just creating trunk and leg strength, we can create trunk and leg strength in a million different ways that don't have to be so aggravating, that can still allow you to train with less discomfort in your knee that is going to get in the way of other stuff.
Hobby weightlifters and competitors training might seem the same, but there's one big difference. Competitors need to hit their best lifts on the competition platform. It doesn't matter what you did in training if you can't perform when it counts, and your program should reflect that. Instead of following random programming, maxing out all the time, and hoping for the best on game day, our Competition Strong Team program focuses on long-term progressions that set you up to have your best competition day yet. Each training cycle is carefully designed around the USA Weightlifting National Circuit, so you'll hit your biggest lifts at the Arnold, the American Open Series 2, and of course, the National Championships. If you're ready to take your training to the next level and get platform ready, then click the link in the description below or scan the QR code on the screen for a free week trial today. All right, back to the show. I want to come back to this because I think you've got something really good here. I'm going to answer some of these questions and then let's go into some more specifics, right? So here's kind of where we're at. My front squat is like 95% of my back squat. My clean and jerk is my front squat. So I'm definitely capped by my strength here, right? Like I have really efficient technique. I don't squat 300 kilos, but you know, I'm clean and jerking 120. My front squat is 120 and my back squat is like 130. To me, I'm looking at that and I'm going, well, I most definitely need to get my back squat strength up. Like that is something that is clearly limiting me here. And I'm going to add in another little bit of context. Let's say my deadlift is really good. My deadlift is, you know, I'm back squatting 130, but my deadlift is we'll call it 190, right? Unreasonable. It's a little strange, right? But clearly back squat strength is like something that is necessary for me to maybe increase my capacity for the snatch and clean and jerk. Frequency, squatting, back squatting once a week, front squatting once a week. And I'm doing a pretty traditional approach to it. Maybe I'll hit one top set and then a couple drop sets and call it a day. Or maybe I'm going to split it up. I'll do one top set on the back squat once a week, and then the other day I'll do maybe a little bit more volume work, right? So that's kind of where we're at here, right? That's that, and to get my squat up, I feel like I have to touch 90% if I'm going to want to touch 105%, right? What's the next step?
And you're saying this is knee pain in this example only in the back squat, not the front squat?
Only in the back squat, yeah, not in the front squat.
I would honestly bring that person down into back squatting once every other week.
That's, you know, I'm going to go and say that's probably something some people may be a little shocked by, right? Like, what do you mean? I'm only, like, how do I write a program if I'm only back squatting once every other week? I can't just do a linear progression next week. What am I supposed to do?
Yeah.
So what does that look like? We're going to reduce that frequency. Are we going to replace it with anything, or are we going to just try and reduce the frequency?
You can replace it with front squats if those are tolerable. If that athlete is like, I'm really good at front squats, I like front squats, they don't bother my knee at all, you're still getting that axial load. You could replace it with deficit trap bar deadlifts. Again, another tool that we don't use often enough in weightlifting, right? Because the way that a trap bar deadlift is set up, you're still kind of in a high bar back squat. And then if you put it on a deficit, you're going to get more of that knee range of motion, but without the axial load. And that need to kind of balance, which can sometimes be kind of the hairy part of like why people feel knee pain, is having that to balance that horizontal displacement of the bar or that trunk change. And so that's just another way to, you know, and then if you're at a gym that has this kind of stuff, like, well, most CrossFit weightlifting gyms don't have it, but if you happen to be someone who lifts at like a Globo, what about a leg press?
Amen. I feel like the leg press is underutilized. It was actually like a while back, I put out this weightlifting program. I called it Ollie Building. It's just like a combo of weightlifting and bodybuilding. And the thesis behind it for me was that we were going to use implements that people don't really ever use in weightlifting programs. We're going to use cable machines and we're going to use a leg press instead of a back squat, right? And following this program was like some of the most fun I've ever had on a training program. And my legs got strong because I was getting them strong on exercises that didn't hurt my body. And then when I went into the back squat, the next training cycle, I was able to push really hard because I just built up all this muscle and confidence too. That's another thing, you know, confidence in my legs because of all the work that I was doing. Right. And I think what you're saying there is really good.
It's so difficult as like a weightlifting coach, I feel like, because every other weightlifting coach, it seems like, is only pushing these standard variations. And so all the programs that we've studied, that we've used ourselves, most likely, right? That we've used on our athletes are with these main variations, just because that's what, I don't know, society says, well, that's what general weightlifting methodology is. You know, oh, we look at the Russian stuff, like they're not, you know, safety bar squatting, they're not trap bar deadlifting, they're not doing leg press, right? But it almost feels like you're like lost, like you're in the wild west when it comes to like programming those things. But I think it's really just as simple as how you would program a regular, say, back squat variation, right? But you just have to understand, like, I don't know, I guess like the biomechanics, like, you know, like, okay, like a leg press is going to be, you know, it's not axially loaded, you know, you're not loading the spine, like you're really just loading the legs at that point, right? So, oh, maybe we need to load the trunk in some way, in some sort of squatting variation in a different way. But just like those little variations that I feel like it could confuse a coach. It confuse me when I'm going to write a program and somebody can't do back squats right now, right? Um, it's almost like you just want to use this like one tool that you have to fix everything, and it's always back squats. Um, that's so valuable, and I think like even for someone not experiencing pain, I think in an off season, in a volume phase, it's probably so beneficial to include some of that stuff. And like you said, maybe squat every other week. Who cares? At this point, who cares, right? Write a 4-week cycle. You got 2 squat days in there. You know, it's volume. You don't compete for a long time. It's fine. We don't got to worry about it. But be doing leg press on that other day. Rotate, squat, leg press every other week, right? Like, I don't know. Try it out. See if it works, just like any other programming methodology. Like, I really want to, we should honestly, you know, rework maybe that the Ollie building program or do a second variation. That would be so cool. I think that's such a cool idea.
There's another another variation that is going to blow a lot of weightlifting coaches' minds, that is really helpful is quarter or partial squats. Like not every squat
What do
has to
you
be
mean?
below
It's not a squat if it's not full depth, right?
right. I mean, like, I think Weightlifting House just put out that video of that young female lifter squatting like 215, and the internet ate it up and was like, "That's not a squat. She's not a below parallel." Well, she doesn't compete in powerlifting, so like, why does it matter? You know, why can't we do partial range squats just above parallel or even quarter squats to still get leg drive, still get leg development without going to um, whatever point of pain? Like, let's say you get pain just below parallel. Why do we have to keep pushing our heads, like beating our heads against the wall? Let's do a partial range squat again, and then combo that, like maybe superset that with a deficit pause deadlift. So you've got the lower end and then you've got the top end, and you just don't have to meet in the middle.
I see like limited lifters that are more limited, like say their leg strength is not an issue in the clean, but they can't hold the tension in the positions in the jerk dip. Well, like wouldn't like a, you know, squat to a box or a partial range squat be really beneficial because you can overload it a lot more, work on that trunk strength at much heavier weights, and not be limited by your end range of motion per se, you know?
I think that what we're talking about here is kind of an interesting idea in weightlifting is that it does seem like It does seem like specificity was the thing that people really latched onto, and I think it's important to, right? Like if you want to do well in weightlifting, you've got to do snatch and clean and jerk. You probably have to do some of these other exercises that are going to support that, like the back squat, the front squat, strict pressing, push pressing, that kind of thing. But then we start to get into this lens where sometimes that's interpreted as you have to, right? Or you have to do it specifically in this way. So some people will bring up your argument about this girl who squatted, 215 and it's not to full depth. Well, people will say, why do we have to squat to full depth in this context? Like, well, then the normal weightlifting coach is going to look at that and say, well, because we're going to catch a snatch and a clean that low, we need to be prepared for it. How do we reconcile this difference between like a need for specificity and wanting to make sure that we're pushing the things that seem to matter most with adjusting the plan and saying that like, well, yeah, the leg drive, like squat strength is important and being able to squat deep is important, but is it more important than just general overall development of the legs that maybe comes with a slightly altered range of motion in the squat or choosing different exercises like a leg press? Why, is it more important to have the specificity or is it more important to just have the general capacity?
I kind of take it a little bit different approach to that. Specificity to me is snatch and clean and jerk within the rules of competition, specific to the athlete who is competing. Because who says it has to be who says you can't compete with a power snatch or a power clean, right? Like we've seen world records get broken in competitions with power variations, right? Some people receive all of their snatches like barely with the butt barely off the ground. And then you've got some people who catch them all at parallel, right? Um, so the only specificity that matters in weightlifting is snatch and clean and jerk within the rules of competition. Taken further, the only specificity that matters is what is most beneficial for the athlete. So when it comes to the plan, is the plan written for that athlete? Now, yeah, you could argue, well, um, we want to be able to train the full lifts. We don't want to just rely on powers and power cleans. But if you're going to spend, let's say for an example, it's going to take me 6 months to teach you how to full depth snatch your like 95% of what you can power snatch. Where could I just spend that 6 months like developing your power snatch to where you would just win, you could medal at all national competitions in the snatch portion, right? Same thing with clean and jerk. And so when it comes to like, I think your original question, correct me if I'm wrong, was sticking to the plan versus like deviating to get general adaptations. Um, you know, coaches got to be, we have so many athletes in weightlifting now that have so many different backgrounds and so many different things that they just really excel in. We have so many different athletes who have like different strengths and weaknesses that coaches really, I think, need to start, and we've kind of been talking about this, break away from the like that mentality of like, well, this is how I've always done it. Like you've really got to start to get creative and think outside the box. And the plan is to always be able to change the plan if necessary for that specific athlete.
This was a big theme of one of our most popular episodes. It was an interview with Derek Beauchamp, and the I think the thumbnail that I made for that is like weightlifting norms are killing you or killing your progress or something along those lines. But a big topic that we covered was that you don't have to do things the way they've always been done. And the only reason that they've always been done that way is because other people say this is the way that it's always been done. But so with that kind of lens, like what are some things that you think maybe athletes and coaches should consider really reconsidering in that, like we always need to be squatting once a week and front squatting once a week, or we need to make sure that we train our front squat and back squat to the full depth so that we have that carryover to the Olympic lifts. Or even more broadly, right? We stick to most of our training is done on the barbell, right? What are some areas that you think most people should start to reconsider when it comes to weightlifting norms in their training?
I think one that is already being reconsidered, has been talked about a lot with Olivia Reeves, especially, is training frequency, like sessions per week, right? Um, that you don't have to train 9 to 11 sessions a week, like to be a high level lifter. That you can't have like um, time where days like full days off in the middle of an intense cycle and still be a good weightlifter, right? I think we're starting to really um, break away from this idea. We're starting to really accept the idea that like true progress is made in the recovery so long as the stimulus provided demands recovery, right? And so it's not just like do a little bit of whatever and then recover and then you're going to get better because you're not doing too much. Like you still have to do enough, but the key is enough, right? Um, that's that. I think that's one thing that we're we're really starting to move towards is reevaluating how often we need to train and then how many exercises we need per session too, like to really get. And it's not just so much like a fatigue thing, but it's also I think to develop an athlete, the athlete has to not, it's not always about like enjoying training, because if you're a dedicated athlete, you're going to do it whether you want to or not that day, right? But there comes a drop off in like what is like the ability for you to stay mentally engaged with your training. You know, if I've got to work out that if every day that I go to the gym, I've got 9 things to complete, I'm gonna probably mentally tap out around like 5 or 6, and then if I do this 7, 8, 9, 10, um, I'm gonna like half-ass it probably. And is it even worth doing at that point, or is it more beneficial to create more training density for the things that I'm like engaged in, right? And so sometimes we throw like, it's not just throwing too much as far as like sessions per week at athletes, but historically we've also thrown a lot of stuff, just like too much in general, right? Give the athlete enough to stay engaged, to get a productive training stimulus, and then get out of the gym.
I'm gonna throw another one out there, and I'm curious to hear your thought. Like, um, what about novelty? You know, as if we're doing kind of just straight traditional weightlifting programming, you're gonna snatch, clean, and jerk probably twice a week, back squat, front squat once a week. You're going to um, you're going to do pulls, and you're going to do the same accessory exercise that you've probably been doing for like 3 years: dumbbell rows, back extensions, that kind of stuff, right? I think novelty is probably a really underutilized tool for increasing just engagement with the training program itself. A switching of exercises up that is a new, like, one thing that I love to do with our in-person people is like when they come in and I could just see that they are just like not really feeling it. You know, they're kind of like talking to each other, like, yeah, I think I just need a break a little bit, that kind of thing. I'm going to go in and completely scrap the plan that we had for the day. I'm going to do something that I know none of them have ever done before, all in a group together. And it's going to be so much fun. Like, one example of that recently was just, we've never done jerks from the blocks. We train in a high school weight room most of the time. And so they're used to doing either clean and jerks or jerks from the rack. So they've never used jerk blocks before. So we did a session where it was just a primer of concentric only jerks, and they were like, why are we doing this? I'm like, just because you've never done it. Like, you know, it doesn't matter. Like, I just want you to like find something new in this exercise that you can try to focus on that might get you like feeling it a little bit more and more engaged. And then we went into just jerks from the blocks, and just about every single one of them hit or tied PRs from the blocks, and they were all having a great time. And I think that that's like a really important thing that weightlifting coaches can maybe take away is like, yes, have a plan, but also be willing to recognize when like that plan is no longer serving you guys and to adjust it on the fly. And it's okay to do that too.
Yeah, I think those kinds of things are super helpful. I think Calvin, you mentioned it before, in like, you know, you just come off of a meet and now you're in a higher volume phase. You're kind of in a, like a GPP type of phase. You're maybe 4 or 5 months out from a meet, and we're not peaking. I'm not, you know, we're not going to throw high intensity like snatch, clean, and jerk from day one. So we're doing whatever we can to just get a help, like a more physically fit individual maybe put some muscle mass back on because we haven't done a lot of volume. And so I think novelty at that time is super helpful. Breaks up the, boredom sometimes of weightlifting. It kind of gives your joints a break, because you're starting to have to find, your brain has to process different movement patterns or different input, right? I think another highly underutilized, you can call it novelty if you want, but another underutilized tool in a weightlifting coach's toolbox is just general boring cardio, which, I mean, one, we still have a heart that we have to, keep healthy, and lungs, right? Um, if you want to talk about like the data, running does have protective uh, effects on the knees. It's not detrimental to the knees. It actually makes the knees more resilient. And so if you're not in a heavy squatting phase, if you're kind of coming off of a meet, if you're kind of in this phase where you're doing a lot of volume of stuff, like I have no issue. I do it myself. I have my athletes do it. Going for short runs. We're not talking like go to the track and try to get like a 200-meter sprint PR, but get some cardio in, break up the training, get out of the gym a little bit, develop better conditioning so that your body can recover because it helps with your recovery efficiency. So as we're starting to push into the later phases and later cycles, getting closer to competition, you have the ability to recover more effectively. Um, so, it's something that people don't utilize often enough. Like a good bike and some running shoes is a great way to recover from some heavy, intense training.
Absolutely. Okay, I wanted to go into. We've got two final things that we're gonna cover here. First one is I just want to go over a couple kind of myths around weightlifting training, and get your quick take on them. Maybe if it's not so quick of a take, that's okay too. So the first one here I've got. This is a myth, I believe. Bench press is bad for your shoulders and will make you too stiff to snatch or clean and jerk.
Yeah, definitely that's a myth. Um, Getting stronger in any area doesn't make you stiff. If you look at some of our, if you look at some bodybuilders, right? They are some of the most mobile folks. Um, outside of having any neurodegenerative disease that breaks down joint and muscle tissue and the elasticity of those tissues, stiffness is a perception largely influenced by the usage or the lack of usage of a body part. And so if I'm having a hard time getting overhead mobility, it's probably because I haven't really trained a lot of overhead mobility.
I mean, that's pretty. I mean, that's a pretty succinct way of saying it, right? Like, and it doesn't make any sense once you push back on the argument at all, right? Oh, how is specifically the bench press limiting your range of motion in another exercise? Well, you ask somebody about it, and they'll say, well, it makes you too tight. And I'm like, well, is it just that you're really sore? And the next day it's hard for you to get into the snatch position? Well, maybe it just means that you need to program bench presses not on the day before you snatch, or maybe not on the day before you have a heavy front rack exercise, if you know that being a little sore and stiff is going to do that. But then the other side of that is people assume that, like, if I'm bench pressing, that means that I'm going to be exactly like those dudes who are at the gym and just doing bench press 2 or 3 times a week, and that's all they do. And they never challenge their overhead mobility. They never moving overhead at all, and they're never trying to overhead squat. So of course they're stiff in that position because they don't train it. They don't spend time there. But we're thinking of the extreme. We're thinking of people who bench press all the time and don't do anything else. We're applying that situation into what it's going to be like for me if I bench once a week, but I'm also snatching and clean and jerking 2 or 3 times a week. It doesn't hold up under any argument. And then if you're to say, like, well, what should you do instead of bench press? People will argue dips. Dips are the thing that you need to do to replace it. And you're like, how is this any different? It's training the chest, it's building muscle in the chest, it's hypertrophy work. So theoretically, with your same argument about bench press, it's going to make you stiff. But for some reason, dips are better than bench press in this context. It doesn't hold up. It doesn't make any sense,
Technically, dips force your shoulder to go even further in the opposite direction of overhead work. So if the argument is strength in a directional bias, create stiffness, then dips would make it even harder for you to get your arms above your head.
And this is a real argument that I've seen somebody make like this week. So that's why I'm bringing this up, because it drives me insane. But I think we've kind of put that to rest. Let's go ahead and talk about imbalances here. Now, imbalances are a tricky one. I've heard people say that imbalances are natural and that spending time trying to be perfectly balanced is a waste of time. But then there's other ends of that too, where, if an imbalance gets worse and worse over time, it can lead to kind of something like what Calvin's experiencing, right? He's got a overhead. When he's got the bar overhead, the bar looks uneven. That bar is at a slant on one side, and that's not, like, to a small degree, it may not be that big of a problem, but then it gets worse and worse and worse, and you're starting to perform at really significantly high levels. When is imbalances worth addressing, and when are imbalances not worth addressing?
I think imbalances are worth addressing. Like, you're right, imbalances are common. There is no such thing as symmetry, right, in the body. But imbalances to me are worth addressing particularly if they are a result of a significant injury. So if you tore your ACL and you have like a significant imbalance of like quad and hamstring strength and also size, that's something to address. If you had a significant knee injury, and that is like you can see like the imbalance in the way that you receive a clean, like you're like basically on one leg and the other leg is just down for support. That's something that I want to address, because that is going to cap your ability to lift significant weight, right? And then I guess the example you just brought up, if it's noticeable to the naked eye and it's noticeable to the point where it worsens as we get closer to, again, what we would consider a meaningful performance, right? Like every time you're at 80% snatches, like you see that bar just dip more and more and more and more, and it becomes harder to stabilize. Then we're having, again, conversation about that imbalance is impacting your ability to create a meaningful performance. And it could even be a risk factor, like you just dropping that bar on your head or your back or something, right? Um, yeah, so safety would be a cause for concern. But the biggest thing is like, is the imbalance so noticeable to the naked eye without me having to pull out like measurement tools and all this kind of stuff, and progressively worsening as we get closer to the numbers that we want to hit? That's something that we're going to talk about.
So I'll talk about that a little bit. Maybe some of the viewers would be interested in what I'm dealing with too, I guess. But specifically, very noticeable in the jerk that one side is quite lower. You can tell it's at the shoulder. For a while, it was causing press outs, and so that's when I was really concerned about it, because that's a competition. That's like, this would affect my competition results. And then for a little bit, I was fully locked out with both elbows, still sagging on one side, and I started to not care as much about dealing with that imbalance. Then I had an elbow injury in comp during snatches, which I kind of attributed to that shoulder function, and putting my one elbow in a different position. You can't be sure that that's the cause, but if anything, getting more stable overhead in that shoulder is probably a really good idea. But yeah, honestly, like, I don't know. It's like, when I approached it, like, is this affecting my competition results? And is it like the reason I'm missing lifts? Then I'm like, yeah, I really want to address it. But like, if it's just crooked and I have no pain and nothing's happening, and I just happen to be a couple inches lower on one side, and it's not like necessarily getting worse. Like, maybe it's like the same from like 120 all the way to 170. Like, I mean, is it really like, you could try and predict like, oh, this might cause something in the future, but you can never really be quite sure about that kind of thing. And so but then it did cause something, right? Maybe. Still, we don't even know that. But it's a pretty good guess that probably caused something to do on that side, in that elbow. Of course, the other thing I mentioned is that I did drop a snatch right on my neck, because my right arm gave out, the one I always deal with those problems with. And so that's kind of a safety thing as well. So I don't know. It's like I guess there's probably not like the greatest like one size fits all answer for like should you address this imbalance, but yeah, it's probably super like conditional on what someone's dealing with.
Yeah, just I mean, we don't have to dwell too much on your specific situation if you don't want to, but just hearing what you're saying, it's definitely something that I would consider addressing. And then the question is, how are you addressing it, right? Like, what's the method you're using to make meaningful change in that shoulder, in that arm as a whole, and how are you measuring if it's effective or not? Because that's the biggest thing, right? Like, what are your benchmarks, right?
So here's basically I took a pretty simple approach and I did a Y hold, like a prone Y hold with a 2.5 kilo plate. And my right side was 30 seconds and my left side was 45 seconds. And I was like, oh shoot, like that's pretty big difference. Like percentage wise, very big. Um I'm like, okay, I'm gonna start training these Y holds and really emphasizing my bad side. And then over the course of just 3 weeks, I got them to be even. I actually had the last test I did on them. I was testing it weekly. My right side actually was able to go longer than my left side before giving out, just like a max hold. And that strangely, right? Maybe not so strangely, came right along with much more even results in my Olympic lifts. As far as like where that shoulder was going, like I think I finally it's been months and months since I hit like a 150 kilo jerk that was not noticeably much lower on one side. I was able to do that, and even a really good one with 160, and I'm like, okay, maybe that's related, right? At a certain point, you're kind of just guessing in the dark with some of the assessment methods because you're going to have imbalances, like you said, naturally everywhere. Um, but I know if I do like a clean grip overhead squat, like my right side is just pulling me forward and my left side is totally fine back there. So it's like, like if I can get feeling good in that exercise and not having that imbalance in that exercise, then my snatch grip's going to be better. And so is my jerk overhead, even though it's not in the bottom of a squat, I'm going to have that more stable shoulder position. I tried to do some other assessments that were more range of motion based, but those are harder to track on your own.
Hmm.
So like working with like our athletic training staff, like at Lindenwood, maybe some of those it's like, oh yeah, looks a lot worse on the right side, but I liked that number. Like, oh, I literally just made a note in my phone. I can track this number over time of how many seconds I can hold, which satisfied my brain a little more than just like trying to look at like an angle.
Yeah, I think having those specific exercise benchmarks is helpful. Like that, you're talking about the clean grip overhead squat, and definitely if that's an exercise where you immediately notice a discrepancy and a big one, I would use that both as the um, tool, but also as the test.
We've got one more kind of myth here is that accessory work is where you put rehab exercises. I'm going to throw that in air quotes there because I feel like you'll have something to say about what a rehab exercise is. What are your thoughts on this?
I understand where that mindset comes from, but I think that is a potentially damaging perspective because it puts rehab work again as or the concept of rehab into the focus on the content and not the context. And I want to keep rehab and training focused on context. And so if we put rehab work as accessory work is synonymous, like what's again goes back to also what I was saying about mental engagement in your training. How often are our athletes mentally engaged with their accessory work as they are with their main work, right? And so the rehab work as accessory work becomes a mental afterthought. I didn't get to it. I had too much, blah, 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 blah. And then another reason why my rehab, quote unquote, didn't work. But if rehab is reframed into the entire context of the training day, the whole microcycle, macro cycle, mesocycle, whatever cycle, like if we're repackaging what rehab is, you have to be fully engaged because now I can say that those first three barbell exercises, that's also part of your rehab work. You're going to get as much rehabilitative benefit from the, pause back squats or the quarter squats or the whatever this and that we're putting in there for whatever reason. You're going to get as much benefit from them as you are from everything else, maybe more so, right? Um, the other reason why that's a myth is because it makes it seem like rehab is easy. And anybody who is a anybody who is an athlete who wants to get back to high level competition knows that rehab stints are almost mentally harder than performance stints.
Absolutely. Absolutely. Awesome, dude. Okay, so we've got one last segment here. We've been doing this on our last couple episodes. Is take a question, leave a question. So, how this works? Our previous guest left a question for you, and we would like you to leave a question for our next guest here. So, the previous guest who left this question for you was Leo Todd, and he's a 50-year weightlifting coach, and he's the owner of East Coast Gold Weightlifting. And he asks, what are the most common weightlifting injuries that we as coaches can help prevent, and how can we be proactive about it before it becomes a bigger problem?
Probably the most common weightlifting injury I've seen is low back pain. Next would be kind of a toss-up between knees and shoulders. And like I mentioned before, we're lucky enough in weightlifting where we rarely see these traumatic, like immediate, like, oh, that is a bad injury type of a thing. These are things that kind of creep up. And so what weightlifting coaches can do to minimize this risk is kind of like what we've talked about this entire podcast is asking the right questions. What are the patterns that the athlete is noticing? Bring the athlete in along the collaborative process of like how they're responding to all of the different cycles of their training, how are they currently responding to what's going on in their training now, how are they recovering, all of these questions about like what's creating the mismatch between training load and recovery ability. So we have this traditional view of coach tells this, athlete does that, right? But can we change that now as we move forward in the sport to making coach and athlete more of a partnership as opposed to like a parental relationship?
It's interesting how much this seems to be becoming a theme with a lot of the guests that we have on. Is the collaborative relationship between athletes and coaches needs to be something that I think coaches are prioritizing. I think it's really important, and I think it leads to more buy-in from the athlete as well. So all good stuff, and I think that's a great response for Leo. Hopefully he'll find that useful. Now the guest that you're going to be leaving a question for, and no pressure here. But the guest that you're going to be leaving a question for is Matt Sicchio. He's the CEO of USA Weightlifting. So what's your question for Matt?
My question for Matt would be, what's your vision for the next 5 to 10 years to grow USA Weightlifting across lifters of all levels, but specifically for the top level athletes to continue to pursue weightlifting full time?
Got it. And so we're looking at not just like how are the top 4 like Olympians doing, but how are those like next 20 athletes who, if they could allow this to be a bigger part of their life and, train full time, could they be those top 4 Olympians, right? Like we're looking at not just the grassroots, but we're not also looking at just the Olympians. We want to know those like almost Olympians. What are we doing in the next 5 to 10 years to help increase their chance of being great athletes for Team USA? Is that right?
Yep, exactly.
Awesome. I think that's going to be a great question for him. I can't wait to see the answer. And so I think we're going to go ahead and leave it there, dude. Thank you so much for doing this. Where can people find out more about what you have going on?
Mainly Instagram. It's Neville_legacy performance. And then if they want, shoot me an email. They can email me at neville@legacyperformancerehab.com.
And Calvin, where can people find you?
You can find me at Calvin Lackey 81kg on everything.
And you guys can find me at Big Ben Strength on everything. We'll catch you guys next week. Bye.
If you found this video helpful, then make sure to check out this video here or this episode of the Last Set, Best Set podcast.